Welcome learners. I am Professor Ruchika Kuba from School of Health Sciences IGNOU. Today I will be teaching you patient and worker safety in healthcare. Now the outcome objective of today's lecture is that after going through this lecture you should be able to understand the importance of patient safety. You should be able to discuss the need of patient safety, explain the relationship between the patient and healthcare worker safety, find ways to keep patient and health workers safely in mind while managing a hospital. And you should also be able to recognize the importance of hospital acquired infections in patient and healthcare workers' safety. Before we go ahead, let us understand what does harm mean in reference to patient safety. Harm has been defined as the process of care failure which may cause temporary or permanent impairment of the physical or psychological body functions or structure. The other terminology which is used is error in relation to patient safety. Now what does error mean? Error means the failure of a planned action to be completed as intended or the use of a wrong plan to achieve an aim. And this failure may not always result in harm. Now errors that do cause injury or harm are also sometimes called preventable adverse events, and errors that result in serious injury or death are considered as sentinel events, because sentinel means end, and these signal the need for an immediate response, analysis to identify all factors contributing to the error, and reporting to the appropriate individuals and organizations to guide system improvements. Now let us see what are the categories under which safety issues can be classified. The first is the domain or where they occurred across the spectrum of the healthcare providers and settings. The second is communication. Now failure of communication between patients or patient party and practitioners, or practitioners and paramedical staff, or among doctors can result in failure of the safety rules. Then we have the patient management, like improper delegation, failure in following the advice, failure in tracking, wrong referral, or the wrong use of technology. And the fourth type is the clinical performance. This may be either before, during, or after any intervention. Now how do we classify preventive activities? The first and foremost is universal preventive strategies, which are common for to help in any errors that may occur. These strategies should be implemented throughout the organizations. Then for certain high risk areas we have certain selective steps that needs to be taken, and sometimes they can be indicative preventive activities, that is, these are specific to clinical or organizational processes that have failed or have a high potential to failure. Now let us distinguish the tasks that can result in errors. There can be two types of tasks when errors are concerned. One can be repetitively processed tasks, and such errors may occur while performing these repetitive tasks. Now what are repetitive tasks? These are the tasks which you are doing every day by default. So you do it very mechanically. For example, you do undertake deliveries of patients, or you do a surgical procedure, you do putting in an IV line. So these you do it mechanically. You don't really make an effort to do them because you are so much well versed and trained in them. But why can you have errors? You will have errors once you are fatigued, there is some interruption, there is a time pressure, you want to do it very fast, there is anger, there is distraction, there is anxiety, fear, or boredom. So even though you may be very good, you may cause errors. There are other tasks which are problem solving tasks. These are done more slowly and sequentially, and they are perceived by the individual as difficult. So you require to really concentrate, think how you are going to do it. It doesn't come mechanically. Now examples include making a differential diagnosis in a patient, readying several types of surgical equipment made by different manufacturers. Now errors here are because of lack of knowledge and misinterpretation of the problem that needs to be solved, keeping in mind that these two are very much different. Now let us see what are the ways in which we can improve the safety of healthcare workers. There is a lean approach. The lean process improvement teams are there who take time to fully understand the problems. They try to recognize conditions that lead to injury, such as wet floor leading to slips and falls. And it is also important to understand the behavior of the staff. Then you have the job safety analysis. The deep analysis of different steps of a job helps in finding out the potential hazards associated with the job. The hazardous steps can thus be modified so that the injury does not occur while performing it, and the worker doing the work becomes more alert while performing the step and takes appropriate measures to mitigate it. Then there is also deep analysis of different steps of a job, which will help in finding out the potential hazards which are associated with this job. The hazardous steps can be modified so that the injury does not occur while performing it. One very common example of this is when we talk about taking a sample with the help of a needle and syringe. Now many times when we do earlier, what used to happen is that to avoid injury from the needles, the doctors and the nurses would recap the needle, or they would bend the needle. Now this was a very big potential hazard. It was a hazardous step. So how did we modify it? We forbade anybody to either bend the needle or recap it, and we said that okay, there is a needle destroyer, you immediately put it in the needle destroyer and dispose it at the site of generation. So this is an example of how the hazardous step analysis was done and how it was modified. The worker doing the same work becomes more alert while performing the step and takes appropriate measures to mitigate it. If he knows that yes, I can be injured or I can injure the patient, he will be more alert when he is performing certain steps. So for this, training and knowledge, awareness, very important. Now managing the work, quality improvement and patient safety should be reviewed regularly. The frequency of review depends upon the policy of the organization. So once you are reviewing it, you know that which are the areas where most errors are occurring, which are the activities or jobs where most errors are occurring. So where we require certain modifications, where we require awareness, knowledge or training. Ideally, the safety team of the hospital should meet every month and discuss the safety issues in detail. We have a safety committee, and the committee should include the frontline caregivers as well as members of the management team. The purpose of the safety committee is to review all incidents and ensure that root causes have been found and corrective measures have been taken. The committee can devise a checklist or performance scorecard wherein most of the aspect of safety is written. The scorecard should be filled regularly. The comparison between the employees can be made, and the performance of an employee can be tracked by keeping record of his performance scorecard. That is it that this employee always falters, always errors, or are there certain times when this employee may error. For example, we may find that certain procedures when performed by a nurse at the end of her shift results in more errors. So it can be so timed that the errors do not happen because fatigue sets in, and at that time maybe errors do happen, or there is a pressure of time, a pressure of winding up and going back. Then the refresher training must be always adopted. The various topics which can be given during refresher training are injury and illness prevention, patient handling and ergonomics, security and workplace violence prevention, infection prevention and control, emergency response for fire and natural disasters for which every healthcare worker should always be ready, the hazardous material and chemical safety, and equipment safety. Now these are the various ways in which the controls can be adopted, and we have given certain examples of for worker safety, for patient safety, for both workers and patients. So we have elimination. Now elimination, the worker safety example is immunization, for example against hepatitis B. For patient safety is designing tubing connections so that they cannot fit other ports. And for both worker and patient safety is, for example, removal of the latex based products which prevent very common allergic reactions which may occur. Then we have engineering controls, for example ventilated cabinets for compounding of chemotherapy drugs in the pharmacy, safety engineering sharp devices, blunt suture needles, patient lifting equipments and MRI control rooms will all help in aiming towards the worker safety. As long as the patients are concerned, bar-coded patient identification bands for medication injury administration systems is very important, because if we know that these particular patients are for cancer therapy from the bar-coded patients, only those patients will be given those medicines. Then smart pumps can be there for IV infusions, and RFID sponge counter technologies can be adopted. As far as both the workers and patients are concerned, isolation rooms with negative pressures and ventilation to reduce the transmission of airborne pathogens can be adopted, and we can have separate decontamination units. Then we have certain administrative and organizational controls. From the point of view of worker safety, you find that staffing levels, staff rotations, standard or contact precautions and training prove to be very useful. As far as patients are concerned, there must be checklist for the central line insertions, timeouts prior to surgery, competency testing, daily hurdles and pharmacy rounds. If we can take care of both workers and patients when we customize the staffing mix and level based on the patient or resident activity and of needs and monitor, and hand hygiene. Then we have PPE and individual level and behavioral responses. For example, for the workers, they must wear wherever appropriate the gloves, goggles, respirator masks and perform hand hygiene to protect themselves against most of the infections that they may encounter or they are exposed to. Similarly, immunization specifically for hepatitis B is very important. As far as patients are concerned, they also must perform hand hygiene, gowns, gloves, masks and appropriate immunizations are important. For both, again immunization is the mainstay, especially for influenza, and the tuberculosis infection testing is also important. At times substitution may be required for the worker safety. Examples include the digital imaging instead of wet chemicals and microfiber mops instead of the conventional mops can be adopted. For the patient safety, we can have substituting bottles of the concentrated potassium chloride on nursing units with pre-measured unit dose vials, so that there is no overdosing which happens. Already we have selected what dose can be given to each patient. Then of course for both workers and patients we have the slip resistant floors, changing from the germicide spray solutions to wipes to reduce the aerosol respiratory irritants. So these are the examples which you found how the various controls can be adopted. So thank you very much. I think you must have learned a lot of things today. So for this patient safety class today, you must have understood what is harm, what is error, and then we also talked about what are the various measures that can be adopted for worker safety, for patient safety, and what are the various controls at the various levels that can be adopted for both patients as well as the workers. Thank you.